in both poor areas and in rural areas, you have increased challenges with things like access to broadband, access to technology. There are fewer schools that have one-to-one computing. And so these were all major challenges that have been faced by rural schools and rural school districts.
Hello and welcome to episode 114, the first full Rural Matters episode of 2022. And I have to say, the first of a very special series that I'll tell you about in just a moment. I'm Michelle Rathman, and as always, thank you for carving out time in your schedule to listen to another conversation about the issues that help increase awareness, inform discussion, and promote what we really believe that you'll agree is intelligent dialogue about the important matters facing our rural stakeholders today. And a new year brings new challenges, and with that, new opportunities, we hope. As a reminder, we encourage you to subscribe so that you can get each new episode delivered to your smart device. Also, please reach out to us with ideas and let us know if you'd like to expand your rural reach. And you can do that simply by emailing us at podcast, that's plural, the number 2day@gmail.com. Again, podcasttoday@gmail. And finally, let's keep this and other Rural Matters conversations going on Twitter. When you do, please mention us at Rural Matters Pod or me personally at MRB Impact. Now, as I said at the top, this is our first episode in a very special 6-part series we're calling Living in Rural America 2022 and Beyond. And what makes this series so important is that we're collaborating once again with the Robert Wood Johnson Foundation. Now, if you're a longtime listener, I thank you for that. But if you're not familiar with this, you may recall that we've done 2 previous multi-part episodes with Robert Wood Johnson Foundation, and we're pleased to be working with them again, which I think is an understatement. But let me just share something with you about this series. During this series, we're going to cover a wide range of topics. And in planning each episode, we knew it was important to approach subjects through an equity lens. And this day of recording is the day after Martin Luther King Jr.'s birthday, so it's appropriate for me to mention this. Now, if you follow Robert Wood Johnson Foundation on social, you might have caught this week a very clever graphic that helps to explain the difference between equity and equality. And I think it can't be said enough that too often it can be easy for us to kind of not stop and take stock of what those terms really mean. So the graphic was really simple and yet so brilliant. Now imagine this, if you just kind of close your eyes and go with me. Across the top row, I think we're 5 or 6 different illustrated people, of whom are of different shapes and sizes. Now, each of them on the top row had the exact same illustrated bicycle. They were on the same exact bicycle. So a really, really tall guy has the same bike as a very, very short person who can barely reach the pedals. Now, this one was labeled equality, whereas the bottom row has the same illustrated people, yet each of them have a bicycle built to suit their own needs, to fit their body style, if you will. So this image is the equity image. And I, again, wanted to share that with you with the hopes that you'll listen to today's episode and future discussions of this nature, thinking about the concepts of equality and equity on all matters pertaining to rural. So with that, let's get right to today's conversation. In part 1 of this series, we're discussing myths and realities of living in rural America and presenting you with some really important actionable information from recent studies and reports in this area. And joining me is a power-packed panel of experts, and they include John Pender. Now, John is a senior economist in the rural economy branch of the USDA Economic Research Service. His research focuses on concepts and measurement of rural household and community wealth and well-being and impacts of development policies and programs on the U.S. rural economy. John, we are so happy to have you join us today. Welcome to Rural Matters.
Thank you.
Now, also joining us today is Partridge. He is Professor Partridge is Swank Chair of Rural Urban Policy at Ohio State University. He edited one of the Presenter Regional Economic Journals and is affiliated with numerous journals, and he has numerous publications, and they include more than 160 journal papers and 65 other reports. Dr. Partridge, you should know, frequently addresses academic and practitioner groups around the world, and he is a leading rural policy expert and has worked with many organizations, including including European Commission, state and local governments, and World Bank. And he researches local poverty, inequality, and rural economic development. Mark, we welcome you to the podcast. Thanks for joining us. All right. Next up, I am pleased to introduce you to, thanks, Mark. I'm pleased to introduce you to Kai Schafft. And Dr. Schafft is a professor of education and rural sociology at Penn State University, where he directs the Center on Rural Education and Communities. His work has broadly focused on rural education, youth development, and social spatial inequalities. He has authored or co-authored over 90 articles, book chapters, and reports, and co-authored or co-edited 4 books, including Rural People and Communities in the 21st Century and Rural Youth at the Crossroads Transitional Societies in Central Europe and Beyond. So welcome to the podcast, Kai. We are really honored to have you here as well.
Oh, thank you so much.
And lastly, I can't say save the best for last because you're all so great, but I know this gentleman. His name is Brock Slabach, and we go way back because he also is in rural health, although he's a much smarter guy than I could ever hope to be. So Brock is the Chief Operating Officer at the National Rural Health Association, which he joined back in 2008. You should know that Brock was a rural hospital administrator where he gets so much of his wisdom for more than 21 years and has served on the board of NRHA and on the regional policy board of the American Hospital Association. Brock specializes in rural health system development that includes population health at the varied payment programs, moving rural providers into value-based purchasing models. He's a member of the National Quality Forums, Measures Application Partnership, and so much more. Brock, I'm so thrilled that you could be with us here today for this conversation. Welcome to Rural Matters.
Oh, thank you, Michelle, and delighted to be with you today.
Thank you. So we are going to cover a broad range of subjects. And John, I want to go ahead and start with you because, I cannot believe almost three years ago, we were talking about COVID starting, and here we are into the 3rd year. And so, John, just from your perspective, I wonder if you can give us kind of a tee up how have rural people and the rural economy fared during COVID as best as you can tell today, and how are these areas doing it compared to metro areas? And I want to get into a little bit of the differences between the two as well.
Well, thank you, Michelle, and appreciate being invited to be a part of this important discussion. So yes, my agency, the USDA Economic Research Service, we have been sort of monitoring data and looking at trends as we normally do, but during the pandemic, we've especially paid attention to the COVID-19 infection rates and mortality rates. And we've also been looking at what's happened with the economy in terms of employment and unemployment statistics. And so in terms of COVID-19 infection rates, overall, if you look, from the beginning of the pandemic until now, the sort of cumulative infection rates are pretty similar between rural and urban areas. And I should say, when we talk about rural, we tend to use non-metro as a kind of proxy for rural, because that's the kind of the nature of the data that we have at the county level is metro and non-metro counties. There have been cycles of greater infection in metro and non-metro areas since the beginning of the pandemic. So early on, if you may remember that it was really some large urban areas that were mostly affected. And so COVID spread more rapidly in metro areas initially, but by the end of 2020, it was spreading more rapidly in rural areas. Throughout much of last year, through the spring and the summer, the infection rates were pretty similar in both areas, and as the rates were declining. But then since the Delta wave, it's increased again, and the rates began rising more rapidly in rural areas by last September, or late summer, I should say. But then with the Omicron variant, more recently, it's been again more urban areas that have initially been had the more rapid growth in rate, the infection rates. But both urban and rural areas have seen unprecedented growth in the COVID infections since the Omicron variant has come in. Mm-hmm. And then in terms of, I should also say that we also look what happens. You mentioned equity issues, and we have been looking at how things varied between persistently poor areas, which are counties defined as persistently poor, those that have had poverty rates 20% or more, since 1980. And in both rural and urban areas, the infection rates have been greater in the persistently poorer counties than in other counties. Then looking at death rates were initially highest in some of the large urban areas that were initially, had the rapid outbreaks. But by the summer of 2020, death rates had fallen in those areas and were rising in smaller urban and rural areas. So since the early fall of 2020, the mortality rates from COVID have been greater in rural than urban areas, and the share of COVID-19 deaths in rural areas has been increasing. Mm-hmm. So, for example, last October, rural areas accounted for more than 25% of COVID-19 deaths that occurred that month, even though those non-metro areas accounted for only 14% of the U.S. population. Mm-hmm. And there are several factors that make rural people more vulnerable to the pandemic. One is that rural people are older on average than urban people. A larger share of the rural population has underlying health problems that increase their vulnerability to COVID-19. And then a larger share of the rural population lacks health insurance. Rural people live further from hospitals than urban people. And a smaller share of rural people have been vaccinated against COVID-19. Mm-hmm. So many of these things, definitely make rural people more vulnerable. At the same time, although their health has been more negatively affected than urban people by the pandemic, the rural economy has fared somewhat better, at least in terms of unemployment and employment. Since the start of the pandemic, unemployment rates have been higher, and the employment declines from the pre-pandemic period have been greater in the urban than in the rural areas. Mm.
Hey, John, before we go into transition to another subject, I think, Brock, I would be remiss if I didn't bring you in here because, John, everything that you just said, there is an implication for our rural health systems. And Brock, I could just feel your head shaking. Like, these are things that we know, older, sicker, poor. These are things that they're not new information. But I wonder if you could share with our listeners, the here and now, how are our rural health systems? And by that, you and I both know we're talking about small, rural, 25 bed or less hospitals, maybe some tweener hospitals, of course, rural health clinics, FQHCs. I think it's important for our listeners to understand everything that John just said about statistics, because, I don't know about you all, but numbers don't seem to make the impact that we want them to. Brock, what are you seeing on the front lines, because you are so closely aligned with the work of those who are actually dealing with, dare I say, managing, but dealing with this pandemic on the front lines in rural America?
Well, you're right, Michelle. This does translate into a real human impact in our rural communities. Before the pandemic, rural communities suffered greater rates of the big five: heart disease, cancer, stroke, chronic lower respiratory disease, and accidents. Basically, COVID has widened those fractures within the rural space to create now, through all of the phases that John just very capably elaborated on, to where our healthcare systems are overwhelmed. Hospitals are full to the brim. And I think that it's important to note that there may be beds available. In fact, many of our facilities may have open beds, but unfortunately, it takes staff to treat the patients that are in those beds. And so one of our major priority areas at NRHA is reducing rural healthcare workforce shortages. And that is just at a paramount of an issue for us at the moment. And I can't underscore that enough. This translates from two important reasons for this condition in rural areas. The first is, as you mentioned, the epidemiology and the populations that are served. The second is that we have much lower vaccination rates compared to our urban counterparts in rural areas. Some counties, less than 20% of the population is vaccinated. So this is contributing together to make this huge tsunami of care that is not being taken care of very well. I'll stop it by saying that this is also displacing routine emergency care. So, for example, if you have a stroke or a heart attack and you show up at an emergency room, you may wait 6 to 8 hours or longer to be transferred to a facility that can make treatment for that particular problem. And this backlog is really frustrating to our entire system that is overwhelmed and burdened at this point in time.
And we just don't understand the long-term implications. How could we? Because we can't go to the future. But these are the things, the kind of the things that keep me up at night. So thanks for that, Brock. Mark, I want to pop over to you for a moment because
Can I quick?
Sure.
I have a question about the things that John was saying, and Brock too. And John, I was struck by your comment about the COVID rates being higher in persistently poor counties in both rural and urban areas, or metro and non-metro areas. And one of the things that I've been wondering about is whether those counts are in fact undercounts because of the relative differences in health infrastructure and access to testing and so forth. Are those possibly undercounts?
Kai, that's a great question. Brock, do you have any insight into that? Or John?
Oh, absolutely. The public health infrastructure in rural communities has evaporated to whatever was there has now diminished because of the pandemic and the I guess I'll just say the controversy that local public health officials have had in rural communities regarding mostly masking to begin with. And so, yes, there could be a lot of reporting issues and undercounts of data of cases. So I would agree with that assessment. And I think that it's certainly impacting what we're seeing now.
That's a great question. Brock, I shared this with listeners before. It's very challenging for someone like me working with rural hospitals when they feel kind of with their hands tied behind their back that they can talk about treatment and not about mitigation. That's another whole story. So, Mark, I want to go back to you because John touched on prior to talking about COVID and the impacts on rural, did talk about, some bright spots for rural economic growth. But a question I have for you is you've got your finger on the pulse as to why rural communities tend to grow less. And this is not every rural community, but tend to grow less than urban areas. And how might the pandemic impact that one way or the other?
Thank you, Michelle. And I think I want to appreciate the way you prefaced the question by not all rural areas are growing slowly, because that's often lost in the national media's account of what's happening in rural America, that one size fits all, they're all declining, when there are many rural areas that are doing well. And so I think the main thing is that one needs to understand why rural areas are face really big headwinds. They what economists call agglomeration economies, or which basically is a fancy way of just saying that, hey, if you're in a city, businesses are near their suppliers or near their customers. If you're in a city, you have access to much more infrastructure because the larger population can pay for it. You have better access to services, specialized services. You also have, if you're a worker, you're more likely to find a job in a city, so you want to be there. But if you're an employer, you're more likely to find the perfect worker. Where in a rural area, it's kind of risky if you want to find a job, or if your firm want to hire a very specialized worker. And the other feature that rural areas face to bring up these headwinds is that they've one of the reasons why rural areas were what made them the raison d'etre is that they were typically mining or agriculture or forestry kinds of basic commodities. And for the last century, all of those industries have had really rapid productivity growth, don't need as many workers, and so if your big industry is shedding workers, you already have a big problem. And to be real quick, I just should note that one of the that I don't think the public recognizes enough is that some work some of my old colleagues at the University of Saskatchewan in Canada did, is that they found that one of the things that's really driving rural growth is that it's technological change at stores and other kinds of businesses. In other words, we were talking about hospitals. In 1960, small population could support a hospital. Then you could be in a rural area. In 1960, grocery stores tended to be really small, but now they're much larger, and you need a much larger population. That means if you're in a rural area, you're at risk of losing that. So these technological changes at stores are another key reason to put rural areas at a disadvantage. So not that I want to say that means all rural areas are going to fail, as you said, Michelle, but it means you're fighting some really strong headwinds. As far as COVID, I think that what John was saying and what Brock was saying was a really nice, overview of what's happening right now. In other words, if you're in a large city when COVID broke out, those places faced the epidemic. We had the shutdowns, lower housing prices in rural areas look quite attractive if you're going to stay in your house all the time. And so the data, as John said, suggested that rural areas initially had a lift from that these people moving to rural areas and with COVID being a big driver. I think that but then the next question is this permanent? And that's probably, I don't like to believe that short-term trend, a little blip in a long-run trend means a permanent trend. We could all sorts of examples where things turned around. However, here, people have talked about, well, now we can do remote work easier. So people can live out in the countryside, work out there, and don't have to live in the city. And I think one of the things that people overlook, though, is if I can do remote work, that makes living in New York a lot easier because I don't have to commute as often. And that's probably the biggest reason why, biggest thing that would hold, make somebody not want to live in New York. So it's unclear whether the kinds of things we're seeing, these initial effects, are actually going to be long-run effects. And then finally, I want to note that John and Brock laid it out. If we're talking about a pandemic, this is really raising the issue of the lack of healthcare in rural areas.
Boy, it raises, you're right. You're so right there. It raises so many issues. And we're going to take a quick break. But when we come back, Kai, I want you to be ready because, one thing that we have not touched on, which we will next, is really about rural education and rural schools and rural communities, because I think we would be so remiss if we didn't talk about the long-term implications for what has happened to not just, it's to children in schools across this country. Rural in particular has some new challenges, which I think those in rural education would agree did not need. So stick with us. We'll be right back. And we're going to talk about rural education in this conversation. This episode in the entire 6-part series, Rural Life in America, 2022 and Beyond, is sponsored by the Robert Wood Johnson Foundation, the nation's largest philanthropy dedicated solely to health. Since 1972, RWJF has supported research and programs targeting some of America's most pressing health issues, from substance abuse to improving access to quality health care, and now to navigating COVID-19. The foundation is committed to ensuring that everyone in America has a fair and just opportunity to achieve better health wherever they live, learn, work, and play. Find out more by visiting rwjf.org. That's rwjf.org, and follow them on Twitter at rwjf. Now, let's get back to our very important Rural Matters discussion. Well, thanks for coming back. We're having a really wide-ranging conversation in our first of a multi-part series in collaboration with Robert Wood Johnson Foundation. I'm joined by John Pender, Mark Partridge, Kai Schafft, and Brock Slabach. And before the break, we were talking about, all things COVID, of course, because that is still at the center of our lives. But Kai, I wanted to come back to you because you just finished up a presidential term for the Rural Sociological Society. And so I would like you to just tell us a little bit about that term. And then in that context, I know much of your work centers on rural schools and communities. And really want to help our listeners understand and see the connections between rural education and vitality of rural people and rural places. Beyond the pandemic, there's a future. So let's talk about that for a moment.
Sure. Well, as far as rural sociology goes, that's it's an academic discipline that began really in the early 20th century and is associated primarily with land-grant institutions. I teach at a land-grant institution at Penn State, and I got my doctorate at another one at Cornell. And rural sociology as a discipline traditionally has been based within colleges of agriculture, not arts and sciences. And so the discipline is really concerned with the well-being of rural people and places. The particular society that I was president of started in 1937 and continues to be a vital organization. Our flagship journal is Rural Sociology, and I was, because of COVID, I was president for 2 years instead of 1 year, which is, as far as I know, unprecedented in the history of the organization. And I'm glad to now be a past president. But yeah, so a lot of my work has focused on rural education, and I think that a lot of the research in the area of rural education really focuses on the ways in which rural schools function as key community institutions within the communities that they serve. So in a lot of places, they are the major employer of rural areas, and they provide sort of identity to local communities. And you can think about, sporting events and this kind of thing. And they are sites of civic engagement. So in a lot of ways, they're very important in terms of creating coherent communities and also rural community identity. So we've been talking a lot about COVID so far in this show, not surprisingly, and the pandemic has really hit education very hard, and I would say rural schools and rural school districts particularly hard, and that's for a number of different reasons. We've talked a little bit about how poverty and economic disadvantage tends to concentrate in rural areas, and of course that intersects with the challenges posed by COVID. Of course, rural schools and schools in general transitioned into online education, and so automatically in both poor areas and in rural areas, you have increased challenges with things like access to broadband, access to technology. There are fewer schools that have one-to-one computing. And so these were all major challenges that have been faced by rural schools and rural school districts. And that's had tremendous consequences, not only for the provision of education, but for schools as institutions. And I can talk about that in a couple of different ways. One is just that, a couple of years into this pandemic now, educators and educational leaders and educational administrators are just absolutely exhausted. And in Pennsylvania, the state where I work, the most recent figures that I've heard is that in this last year alone, 1 in 5 superintendents in Pennsylvania have either retired or quit their jobs or stepped back from their jobs. And the figures are the same for principals and teachers are incredibly burnt out. I think it's a little bit of a stereotype to talk about how rural schools provide an element of coherence, social coherence to rural communities, and in many cases that is indeed the case. But if you've been paying attention to the news at all, you know that schools and school boards have completely transformed, and the relationship between schools and communities have transformed, and there's been often intense conflict at the local level around masking mandates and educational provision and so forth. And so educators and administrators are trying to deal with this at the same time that they're trying to deal with broadband connectivity, at the same time that they're trying to deal with food insecurity and figuring out how to get food to students and families. And it has just been a real train wreck. And I think that it's going to be some time before we see the true long-term effects of this. But it's all very
You speak the truth, and it's very much to what Brock was saying in terms of what's happening with, public health as well. And so, but gosh, this is not going to be the motivational Rural Matters episode that folks might hope. However, what I do know is with all of these challenges, I mean, we could either all, pack up our bags and go home, or we could take a look at what the opportunities are. And I think all of you on this episode today can agree that it begins, activism is one thing, and policy is so important, because the things that we're talking about, the disparities, did not just exist overnight because of COVID. They were there. I think it's, again, we can shine a light on all these things that we should have been. And I say often, I don't mean to should all over folks, but these are things that we should all be paying attention to. So with that, John, I want to kind of come back over to you for a moment, because where you sit today, access to broadband, I know USDA Rural Development is really putting a focus on providing more opportunities for rural communities to access broadband. Can you talk to us a little bit about, because the technology piece is so important. We know it's important for telehealth, for teleeducation. It's important for rural business development and economy. So kind of give us a sense of what are the areas of the greatest need, and where you see some emerging opportunities that might not have been a priority had we not been in this pandemic, if that's fair to say.
Yeah, thanks, Michelle. I think this fits very well with the topic of the pandemic, because, of course, we wouldn't be having this conversation without broadband, and so many people now depend on broadband for their jobs and as access to health, access to education, and so on. So, yes, it's very important. And so I'll cite I'll talk about what I see are some of the trends, mainly based on Federal Communications Commission data, which are flawed. And so most people that are focusing on rural broadband issues will point this out. And so I want to start with a caveat there. But according to the FCC data, broadband is less available in rural areas than in urban areas, but rural areas are catching up. So the current FCC definition of broadband, or what they call advanced telecommunications capability, is a minimum download speed of 25 megabits per second and upload speed of 3 megabits per second. That standard has been there for several years, and based on that, we've seen, according to the FCC data, that availability of fixed terrestrial broadband increased from about 61% in December of 2015 to 83% in December 2019, while the percent of the urban population with broadband availability increased from 97 to 99%. So rural areas are still behind, but they're catching up, according to that definition and those data. And then the rural areas also lag urban areas in availability of mobile broadband, but have been catching up as well. And then there's also, the situation in tribal areas is even worse. So, and then, looking at places that are persistent poverty, whether rural or urban, tend to be further behind. So that's kind of, the situation at the current definition of broadband. But as we see what these kind of need for video conferencing capabilities and so on, that there's actually a need for faster broadband than what the current definition, allows for. And so, for example, in the Infrastructure Act that was recently passed, the category for broadband that they use for defining underserved areas is 100 megabits per second download or 20 megabits per second upload. And so at that speed, rural areas are even further behind. And so, for example, in June of 2019, FCC data showed that only 72% of rural people lived in census blocks that had broadband availability at those higher speeds, compared to 95% of urban households. So the gap is wider when you go to the higher speeds. And then, the situation is actually, worse than what the FCC data show, because for a number of reasons, the FCC data likely overstate the availability of broadband, especially in rural areas. So I don't know if you want to go into those details, but we've also, if there's an interest, I can explain more about why that is. But looking at other data sources like the American Community Survey, which has data on broadband subscription rates, it basically tells the same story that subscription rates are lower to internet and broadband in rural areas, and that's especially true in persistent poverty areas. So among the areas of greatest need when it comes to broadband are rural areas and tribal areas, and especially persistent poverty areas.
Yeah, and I think it's so important, again, in the context of policy, is that it has to be a priority. It's not a luxury. It's not for people to just be able to access social media or shop online. This is life and death stuff. This is quality of life stuff. And Brock, I'm going to jump back to you because we're talking about the statistics are all out there. We know that we have a significant challenge before us with future rural hospital closings. So let's talk a little bit about policy where you're concerned. And with that, policy that impacts population health issues. Because again, we know, as John said at the top, the definition of rural in context of health, that we hear the same words, older, sicker, poorer, and that's not everywhere. However, it is the case in many rural places across the country. So when we're talking about population health and social determinants of health, I mean, I can't think of a more pressing time for policy to really address putting substantial resources in place to ensure that rural places don't fall further and further and further behind. And that also means losing any structure of healthcare in their communities.
Oh, I quite agree, Michelle. And I think that much of my work over the last several years has been invested in the transition of our providers to these value-based payment arrangements that focus on social determinants of health and caring for the health of the population. I think it's critical that we realize, and the economists on the line would agree with me, I'm sure, that incentives matter. We have healthcare systems in our rural communities that were generated out of payment systems invented decades ago. And this unit-based system of reimbursement, I think, has not served well in this modern age, where chronic disease is growing at just increasingly rapid rates. We don't even know yet the extent to which long COVID is going to impact our rural areas and the ability to care for patients experiencing that condition. But we have to move our providers into payment arrangements that reward them for caring for patients across the continuum within programs like chronic disease management, care coordination that transcends just one provider, looking at patient-centered medical homes and models of clinic arrangements that can be incentivized to care for patients in a more holistic fashion. So this is what we're working on now, and I think that I'm excited that Centers for Medicare and Medicaid Innovation at the Centers for Medicare and Medicaid Services is investing in this through programs like the Global Budget Program in Pennsylvania and other models that are being tested to see how we can move providers into this brave new world.
And hopefully, instead of, from every 4 years or so, changing things. I mean, we really have to pay attention to what works, and it cannot be subject to, policy and politics. They, in my opinion, they are often just confused and they become one and the same. And, so Mark, I want to kind of turn to you as we're on the policy discussion. I have here that U.S. and state and federal economic development policy has tried to bring prosperity to rural areas for the last, 90 years, no small feat, with limited success. So in your estimation and all the work that you've done, why do rural policies often fail to bring the all-important prosperity? Because it's not about surviving. It is about opportunities to thrive. So tell us a little bit about your side of the story where this is concerned.
Well, first, I just want to preface it by, thank you, Michelle, and also noting, as Brock noted, that what you really want to avoid is this vicious cycle that once you start losing people, you lose your grocery store, you lose your hospital, more people leave because the quality of life has fallen, you lose your gas station, and so on. And then if you get too far, there's no way a policy intervention is going to help you. So one of the keys is getting in there early. But there are some other inherent flaws that make policy really ineffective for rural areas. And one is that there's limited funds. The federal government or state government can only put limited funds there. And politicians want to make sure that each little area, their own district, gets some of those funds, and they tend to be spread out too thin, rather than, I know it'd be hard politically, but behind the scenes, some sort of triage where the fastest growing rural communities, they don't need help. The slowest growing ones are hit that vicious cycle. There's probably not much you can do outside of helping cushion the decline. But it's the middle ones that the federal funding or state funding could help. And by spreading it out too thin, we're not giving the ones that could most benefit enough resources. So that's one reason. Another reason is that policy seems to be aimed at propping up industries that are declining, or at least declining in terms of employment. So in rural areas, you tend to get policies aimed at the agricultural sector or aimed at, say, supporting mining or so forth, or forestry. And while there's certainly reasons to subsidize those industries or have favorable policies, economic development isn't a good one, because I've already talked about how productivity growth means these industries are getting smaller and smaller and smaller. So if you're targeting an industry that's getting smaller, you're encouraging your growth in industries that are going to employ fewer and fewer people. So you need to be more thinking about, less about, targeting what was big in the past, and thinking about, well, what would make you grow in the future. And the final thing and I just want to notice is we can look at have areas that receive a lot of farm subsidies, the Great Plains, the little places that received a large amount of money relative to their income, those places haven't thrived. And then, the last thing is that I want to notice is that there's where you send your money is not necessarily where politicians want to do it. And that is that in some places, it's best to send it to rural areas to build the schools or to support small business development, et cetera. But in other cases where the most effective strategy is actually to help urban areas, in that if you subsidize or if you bring in funding to a rural area, they're relatively small. If I want to fix a road or something in a rural area with a government grant, I'm not going to buy a lot of my supplies locally. The money trickles out to the city. And so it's not going to do all that much good. It's not going to stick. Where if I put it into a nearby urban area, on the other hand, more of that money is going to stick because you buy the supplies in the urban area. However, they're more likely to creating jobs actually for rural areas through commuting and so forth. And so in that sense is where another issue is where do you put your funding? And it's often not where the place that you're directly trying to help. And finally, I'll just note that in government policy, one of the failings in economic development is this: politicians and policymakers focus on, if we could get that big factory or that big firm that's going to save us, that'll solve all our problems, but also will get us a lot of publicity. However, the most effective kind of economic development economists have found tend to be in small businesses or new firms. They're not, going to generate high, big headlines, but they're more likely to be effective.
The image just popped in my head of putting all your eggs in one basket versus having a lot of little baskets and a lot of eggs. Hey, Kai, we don't have much time left, but I want to ask you this last question here. And I might just ping everybody else around the table. I have a really good colleague that I admire so much. She's written a couple of books. I will just tell you today, I read one of her blogs, and really the essence was we're never going back to normal. So with that sentiment, what do you think are rural's best opportunities to improve the positions that we're in today with respect to just the focus area for what you're focused on of rural education? What are our best opportunities to emerge, if you can see it, stronger than where we are today? Do you have any insight for that?
Sure. Well, for one thing, just to follow back up on some of our earlier conversation, I've been in discussion with a number of educational leaders across Pennsylvania, across rural Pennsylvania, for a grant that I've been working on. And one of the things that has come up again and again and again, which we haven't really talked about in this conversation, has been mental health needs, and which rural school districts have been really grappling with mental health needs of not only students and families, but also teachers. So that's a huge issue as well. I think that there is a big missed opportunity to leverage the role of rural schools as social and economic centers of the communities that they serve. And our education policy over the last number of decades has really been focused on creating human capital. And that's fine, but what that often ends up resulting in is selective outmigration from rural places. So sort of the typical notion of the brain drain, which just through processes of economic migration leave rural places poorer and older than they were before. And I think that there's a real opportunity to re-envision the role and the purposes of rural education and education in general in the ways that we can re-embed education within the lived realities of the communities that they serve. And as part of the mission of education, help to create new imaginations among young people about possibilities within their communities. And here I think back to a comment that Mark just made about the importance of small businesses and new firms. I think that if we switch a little bit from a focus on test scores and the creation of human capital to the creation of new imaginations for community engagement by young people, that's going to be a real big step forward. But that's a real paradigmatic re-envisioning of the purposes of education. But in the meantime, for the short term, I think that we're really seeing an awful lot of crisis management within schools and school districts, and particularly in rural places. And so sort of in the spirit of first things first, we've got to figure out how to get through this pandemic. We've got to figure out how to do that in a way that that doesn't leave our schools gutted.
So well said. And I think the same could be said. I'm sure, Brock, you would agree with our health systems and public health. My goodness, this conversation, we could go on forever. Honestly, I just can't thank all four of you for joining us. I hope you'll come back because all of your work is so important, and I'd love to have you back and continue the conversation. Unfortunately, we're out of time. Again, just thank you so much to Mark Partridge, to John Pender, to Brock Slabach, and also, of course, to Kai Schafft. All of you, great friends of Rural Matters. We're so appreciative. And I also just want to make sure that I acknowledge and thank our Rural Matters marketing partners. And we've got some new things coming for you. Just stay tuned for the next couple of episodes, and they include the Center for Rural Affairs, NTCA, that's the Rural Broadband Association, the National Rural Education Association, the National Rural Health Association, of course, AASA, that's the School Superintendents Association, the National Rural Assembly, the National Grange, and of course, NOSOR, that's the National Organization of State Offices of Rural Health. And I promised myself I would not forget to say this. Please make an appointment today to donate blood, because we need to make sure that our country's blood banks are not in short supply. And I know so many are in dire need. So I just wanted to throw that out there. Again, I'm Michelle Rathman. If you'd like more information on the rural issues we talked about today, to suggest a guest or a topic, reach out. podcasttoday@gmail is where you can find us. Also, we'd appreciate if you'd rate us. Tell your friends about this. And again, I want to thank my producer, Michael Levin Epstein. You've been listening to Rural Matters. You have a great day, and we'll talk to you again soon.